Join Marty Johnson, the holistic health practitioner and founder of Total Health Nutrition Center in Menominee Falls, Wisconsin, as he delivers these podcasts to enlighten you and give you hope that there are health solutions to conditions that seem difficult to resolve, or even better answers than a medical approach of prescribing a chemical drug, which most times is nothing more than a Band-Aid fix, rather than getting to the root cause of your problem. The mission of the Total Health podcast is to provide the education and support that will lead to transforming people's healths so they can live a much more efficient, productive, and happier life the way God intended it to be. Join him now for his latest podcast.
Marty, would you mind just talking a little bit about some of those symptoms that come from having gallbladder issues?
Sure, yeah. I mean, there's a lot of symptoms that, multiple symptoms. For the sake of this podcast, we'll just talk about some of the, more common ones. The interesting thing about the gallbladder is that a lot of people don't realize that they're gallbladder symptoms, so they're suffering with various issues, not knowing that it's a gallbladder issue. So some of the symptoms that are more common that some people may start to recognize would be generalized nausea feeling, especially in the morning when they wake up. Sometimes it can wake a person up between 1 and 3 a.m. where you feel kind of like nauseous and your stomach's turning and you're not really getting why you're feeling that way or waking up. The other big one is just excessive bloating and gassiness. Can be throughout the day, but definitely you'll notice it much more prominent right after a meal. And when it gets bad enough, sometimes even after drinking fluids, you can feel kind of bloated, where you just feel like your stomach's bloated out, you feel like you're gaining weight, and it's really said there's a lot of gassiness. And if things get more advanced, this is where people usually start to realize that, wow, there's something wrong, is where you might have some right side discomfort or pain or kind of spasming underneath the rib cage. And that's where a lot of people will start to have maybe go in and get tested.
So speaking of testing, I've heard from multiple sources that there's a lot of people that do get tested because they have these symptoms, but then those tests come back normal and they still have these symptoms. So can you shed some light on why that might be?
Sure. Yeah, I get a lot of patients that come in to see me because they're at their wits' end. They're suffering with all these symptoms, and all the medical tests, and there are several medical tests out there that can be done to like ultrasound. They have one where they have you take a dye. It's called a HIDA scan. Sometimes CT scans, and they're looking to see if there's notable blockages of the gallbladder duct or the bile duct, or are there stones in the gallbladder. And many times we find people where these tests look completely clear and normal, yet people are very symptomatic. And the reason that is because of various factors, which we can talk about on a different podcast, but various factors related to toxicity or diet that can cause the bile coming from the liver, and then moving into the bile or into the gallbladder, it becomes thick, and they'll call that biliary stasis, where it's static bile. It's so thick that it doesn't move well.
Wow.
And so that is, if the gallbladder can't move that thick bile out into the digestive system so you can break down the fats properly, you're going to have all these symptoms.
Oh, and there's ways of controlling that naturally?
Yeah.
Or, I mean, because a lot of people they don't know what to do after that.
Right, yeah.
They're not educated.
Right, and they don't realize that there's options. So a lot of people are suffering and don't realize that, hey, there's options, and that's what we specialize in, and what I've specialized in for years is identifying the root cause as to why that bile is becoming thick, and how to address both the lifestyle change issues and address the liver and work with that, address that bile to help thin it out. And those are some of the things that we do in our office. And we can definitely, talk about some of those things in the following.
Yeah, I would love to talk more about the gallbladder because I'm sure there's a huge amount of other things that are interesting that that the rest of the world might not really be tapping into yet.
Thanks for joining us today on the Total Health Podcast. If you'd like more information about how Total Health can transform your health, check them out. They would love to set up a free consultation with you over the phone. Call them at 262-251-2929 to make that appointment. Otherwise, you can check them out on the web at www.totalhealthinc.com.